to work like they now want to get involved.
Sometimes I use my pocket. I use my own pocket money.
It's hard to estimate how much you have spent because at times it will be, you'll see the need on clothes, you'll see the need on health.
We've grouped together now. We've got quality Bakuteli, Banageli, Swati, and we've got and the people from the Umpagats that now they are involved because we even formed an association just to boost the morale of the community.
In Swaziland, there is the OVC Basar, but because of the number of orphan and vulnerable children, the school cannot able to take all of them. They take some and some left behind.
Government compels all schools to admit OVC, and government has taken upon himself or herself to pay the 400 Demalangeni towards the school fees of the child. That most of the time takes care of the tuition or the school fees, but it leaves other school needs like exercise books, stationery, uniform, and bus fare that is still outstanding, and it sometimes presents a problem that might lead to the child not attending school. There have been cases where government has not been able to pay on time, and that has led to some problems between the Ministry of Education and the schools, and there have been cases of children that have been told to go home because government has delayed with the payment. But I believe that the government is working on that, and hopefully there will be a solution to that problem. When you talk about social protection, it's not only what government does, but it's also what the community can do, like the Indlungulu or the Chief's Fields. It's really an attempt to revive a very old system of social protection whereby the chief was the father to all.
I think this initiative just started by mere collaboration with the Nature Office, which is the National Emergency Response Council on HIV and AIDS. We were looking at ways on how we could improve food security for these vulnerable households, especially those that were child-headed. So in this particular case, we're saying, okay, the chief will allocate us a piece of land, will provide the inputs. Initially, we didn't even have to plow. We were expecting the chief to do the plowing and then the sowing. Once that is done, the weeding, the harvesting, even the management of the crop. When this crop is ready, then the chief, assuming that the chiefdom was aware of who are the most vulnerable, will then provide some rations. Let me say nationally, we are looking at about between 3 and 4 million Emalangeni. At the moment, I think if you went to these dry areas, the lowveld we refer to, there are now quite a number of people who are growing sorghum and cowpeas. We've just undertaken an evaluation, but for sure, were it not for the dry space that we've been getting, I think the production has been quite good. I think we have about more than 300 chiefdoms in the country, which through the Indlungulu program, where we are saying 3 hectares per chiefdom, I think we have covered all of those. But now for this micro project, supported project, we are saying the capacity based on the funding, we are only able to cover 26 households per chiefdom.
The number of beneficiaries as a whole, we've got 81,253. the regional coordinator, as well as the HIV and AIDS committee and the extension officers are working together, and they are the one who select the beneficiaries. In case where the harvest is good, the offices are able to get enough yield for food, and extra is sold to provide them with basic needs like school uniform, paying for school fees and all the likes.
It would have been fair really if we were able to get these inputs quite early, let's say like September, August, but we have really struggled to achieve that target. You can't believe that the cropping season has started, but we are still distributing, and this has an impact on the yields. We would like really to expand, especially the individual households. If we had the opportunity, I think as a ministry, we would reduce on the chiefdom managed type of project and concentrated on the individuals, because that's where you are getting a lot of commitment.
What we did was to look at initiatives that had national coverage for the OVC to be taken care of. There are a lot of pieces to this puzzle, and each initiative is taking care of a portion of the needs of the OVC. And we need a lot of other initiatives so that all the needs of the OVC can be taken care of.